Welcome to Class Meeting 2. This lecture we will cover more common drugs used within our culture and society at large, including alcohol, tobacco, marijuana, caffeine, and how and why our bodies respond to these chemicals. We will also explore the principles of addiction, dependence, and the concepts of how drugs can change our brain chemistry. These drugs have had their impact on sports as well as society in general. An addiction can be described as a habit or behavior that is no longer in control of the person and has a negative effect on their physical or mental health. The addiction is marked by a chemical change in the user's body associated with the behavior. The person can no longer stop the behavior on their own despite the negative consequences that they are often not aware of as occurring right in front of them. Some of the characteristics of addictive behavior include reinforcement, which is made known by behavioral psychologists like B.F. Skinner, who found that reinforcements to be an extremely strong influence on behavior, far greater than simple rewards or punishment. A reinforcement is a consequence that will strengthen an organism's future behavior whenever that behavior is preceded by a specific antecedent stimulus. This strengthening effect may be measured by a higher frequency of activity, or a shorter latency, or a greater magnitude. A compulsion or a craving is an overwhelming feeling that a person has that they must do something, regardless of the consequences. A loss of control is when the person no longer has the ability to decide or act upon a situation. And of course, an increase in an unhealthy addictive behavior can lead to negative consequences. This slide shows imaging studies of the brain of a recently abstinent methamphetamine user. It shows neurochemical changes that explain the relapse potential of methamphetamine users. Specifically, the amygdala, which is the emotional center of their brain, is highly activated, which is in the red area, in a recently abstinent meth user, while the prefrontal cortex, which is the thinking area of the brain that helps control the amygdala, exhibits very low activity. This means that when a craving is triggered in the amygdala, the newly abstinent meth user's ability to control that craving becomes impaired. So with drug abuse and dependence, the American Psychological Association defines drug abuse and addiction as a chronic brain disease that causes compulsive substance use despite its harmful consequences, such as a failure to fulfill major responsibilities, drug use in situations that are hazardous, drug-related legal problems, drug use despite persistent social or interpersonal problems. These may or may not produce a physical dependence. So who uses these drugs? Drug use does not discriminate. It affects all income levels, cultures, ages, and groups. However, there are factors in higher risk environments that lend themselves to drug addiction and dependence. There are certain high-risk characteristics, such as what's listed here on this slide, including income and education levels, a thrill seeker or risk taker. Males are twice as likely. Young people are at a higher risk. The peer group that you hang out with, chaotic home environments, dysfunctional families, and parental abuse all can contribute to drug use and abuse. The legalization of marijuana in many states has made it more accessible, affordable, and people are using it more to relieve pain, relax, and socialize. This is a reference chart from drugfree.org on various drugs that can target teens, such as alcohol, cocaine, and crack, over-the-counter and prescription cough medicine, ecstasy, heroin, inhalants, marijuana and methamphetamine, prescription pain relievers, stimulants, steroids, and tobacco. It offers parents information on the appearance and signs of usage and why these drugs are harmful. Knowledge is power, and parents need to be hypervigilant in their supervision of how their children are being influenced by the dangers of culture and society. Children in America have much more unsupervised time and actually more money in their pocket as well as phones that provide much easier access to these potentially harmful substances than in years past. Again, why do people use drugs? Various reasons exist for starting a dependence on drugs. People don't typically wake up one day and say, well, it's Tuesday, I think I'll get addicted to crack cocaine. No, the main focus is in the initial choice of the drug and whether it's available and accessible and whether their peers are using it. Reasons can include experimentation, escape, reliance, or magnification of resonance. In experimentation, there's a desire to alter your mood or seeking a spiritual experience, perhaps. In escape, it can be escape from boredom, anxiety, depression, feelings of worthlessness, or other problems. Reliance could be a reliance on the medical model of prescription medications that have been available, and with a mindset that medications can fix us or fix our problems or situations or conditions. A magnification of resonance means that if you're living in an impoverished area with little economic opportunity, drugs are readily available and an opportunity for economic and temporary success. Some of the risk factors for dependence. There are psychological factors that can predispose us to drug dependence, such as difficulty in controlling your impulses, a strong need for excitement, feelings of rejection, hostility, aggression, anxiety, mental illness, as well as more than one of these occurring at once. Our surroundings within our family, social and peer group, and city and socioeconomic demographics can also be risk factors for our dependence. Drug use and abuse is compounded and magnified when it is done in conjunction with our impaired judgment from other drug uses. Some of the unintended side effects of drug use include nausea, constipation, paranoia, depression, and even heart failure. The range can be very broad. Since there is no quality control in the illicit illegal drug market, there is no idea of what drug users are actually taking. The composition, dosage, and toxicity can be highly variable. Many toxic contaminants can make their way into the drug. Studies have shown that half of all street drugs don't contain the promised primary ingredients. IV or injection drugs such as heroin have risks. And by the way, amphetamines such as cocaine and other drugs are also injectable, as there are other routes of administration. Sharing needles and syringes can lead to bloodborne diseases being spread like hepatitis C and HIV. There, of course, are legal consequences to drug use in addition to the harmful use of the drugs, and the use and possession of many psychoactive drugs can result in large fines and even imprisonment. Drugs have a profound effect on our body systems. The neurological, cardiovascular, respiratory systems, and musculoskeletal systems, just to name a few. The overall effects of a drug on a person's behavior, psychology, and chemistry. This includes the amount of drug required to exert the various effects, the time course of these effects, and other characteristics like a drug's chemical composition. The dose-response function is the relationship between the amount of drug taken and the intensity or type of resulting effect. The time-action function is the relationship between the time elapsed since the drug was taken and the intensity of its effect. And the placebo effect is a response to an inert or innocuous medication given in place of an actual drug. Some drug use history. If it's their first time using a drug, or an occasional drug user, or recreational or habitual or even addictive user, will respond to drugs differently in their bodies. The size and weight of the user, their inherited ability, such as their family history of addiction, or their inability or ability to metabolize certain drugs, the present physical conditions such as pregnancy, or at which trimester of pregnancy drugs are being used, can all have a factor on the person taking the drugs. Sometimes the user's expectation of a drug will affect their response, which is what the placebo effect is, and this has been done on studies with subjects that were given a marijuana cigarette without THC, but they still felt the experience of being high. So, as we look at some representative psychoactive drugs, opioids are any natural or synthetic drugs that relieve pain and or cause drowsiness or euphoria. Examples are opium, morphine, and heroin. They are also termed narcotics. They can induce euphoria, which is an exaggerated feeling of well-being. Common routes of administration are injection, snorting, sniffing, or smoking. Symptoms of overdose can range from nausea to respiratory distress or even cardiac failure. Withdrawal symptoms can include cramps, chills, sweating, tremors, irritability, and panic. So here we take a look at some central nervous system depressants. These are also known as sedative hypnotics and are commonly used to reduce anxiety. Tranquilizers are central nervous system depressants that reduce tension and anxiety, and examples are benzodiazepines, such as Valium, Xanax, Librium, Quaaludes. And some of the side effects in the body can include impaired muscle coordination, slurred speech, mood changes, and drowsiness. Some of the medical uses that are legitimate include controlling insomnia, anxiety, and seizure disorders, and they can be used prior to surgery in conjunction with anesthetics for their calming effect on the patient. And the converse of the central nervous system depressants are central nervous system stimulants, which speed up the activity of the nervous system or the muscular system. A more illicit drug that is a central nervous system stimulant is cocaine. It's a prevalent and prolific central nervous system stimulant. Various street names include coke or snow, and a surge in popularity and its high price made it a status drug in the 1980s. Crack cocaine made the drug available at lower prices to more people. Some methods of transmission include snorting through the nasal passages, injection intravenously into the bloodstream for fast and intense effects, smoking, such as crack cocaine, by processing it with baking soda and water and smoking the pellets in glass pipes. The effects are intense but short-lived, and the euphoria can last 5 to 20 minutes and end rather abruptly. Abuse and dependence could lead to problems when withdrawing or stopping usage, which can also include depression, agitation, and fatigue. Cocaine use during pregnancy can pass rapidly from the mother's bloodstream into the placenta and have serious adverse effects on the fetus. Low birth rate babies with smaller heads have been common. Babies are often born intoxicated and are irritable, jittery, and have had trouble eating and sleeping normally. Cocaine can also be passed through a mother's breast milk. Stimulants can include prescription medications for hyperactivity to maintain focus, such as Ritalin. Amphetamines are covered in our text, drugs, and sport, and have been used and abused to maintain alertness, lose weight, and even for narcolepsy. They are banned for use in competition by the World Anti-Doping Agency. So let's turn our attention to another stimulant, caffeine. And as we can see here, that comes from natural occurring alkaloid in varying quantities, such as beans, leaves, fruits, and more than 60 plants. There's no legitimate chemical difference between synthetic and naturally sourced caffeine. As we see, green tea has a caffeine content, as well as guarana, the cola nut, and yerba mate. And you can, as we obviously see by all the people that drink enormous amounts of coffee in Starbucks, it can reduce central nervous system fatigue and can give you an extra level of alertness for not only physical activity but mental activity. Here we see some of the common popular drinks and their caffeine content. And here we see the caffeine content of various food products and medicines that you may not expect to see in these products. Again, the World Anti-Doping Agency has changed its stance on caffeine threshold allowed in competition, and has even removed it completely from the banned list and put it on a monitoring program, which essentially tables any decision making and provides for a possible reintroduction back into the prohibited list. So here we see an illustration of the effect of stimulants on various spider webs. This study was done on spiders, and you can see the lack of structure in the spider web that was made under the influence of amphetamines and caffeine versus the more uniform and even pattern of the spider web that was not under the influence of caffeine and stimulants. Here's a study that shows with a 5 milligram per kilogram body weight ingestion of caffeine's effects on performance and strength and endurance, which did not show any difference between actual caffeine and placebo usage. So let's turn our attention to marijuana. Marijuana's scientific name is Cannabis sativa. The active chemical compound that contributes to its effect is commonly known as THC, or more formally tetrahydrocannabinol. tetrahydrocannabinol. The short-term effects include mild intoxication, drowsiness, sedation, increased appetite, analgesia, slower reaction time, and memory deficiency. The long-term effects include social detachment and perhaps a psychological dependence. It is derived from the plant Cannabis sativa. It has more than 400 chemical constituents. 60 are chemically classified as cannabinoids. The most potent that produces a psychoactive effect is known as delta 9 or tetrahydrocannabinol. So it has been documented and even parodied has been the use of marijuana by high-profile and everyday athletes alike. Although its use is not considered performance enhancing, the stress of highly competitive sports and the work hard, play hard mentality of athletes lend themselves to using illegal and illicit drugs such as cannabis and alcohol to relax and de-stress. Again, here's some of the root terms of where marijuana comes from and some of the sources that it is and how it can be taken into our body and our systems, and some of the street names commonly used with marijuana. Again, cannabis, the effects, the active ingredients, and how FDA has approved the use of medical marijuana and legalization of its use for medicinal purposes. And here we see delta 9, THC. THC is the active ingredient in marijuana, and it can vary depending upon the source of the plant and how the drug is taken. There are new varieties of the cannabis plant that have bred to have more potent products than those that were available in the 1960s, such as sinsemilla. And sinsemilla is a highly potent method of growing marijuana. It increases the THC content, and it's made from seedless female plants. Some of the mode of action: our bodies have natural receptors that are made for cannabis-related products called CB1 receptors. The stimulation of these receptors inhibits the neurotransmitter release, particularly acetylcholine within the hippocampus and noradrenaline in the cerebral cortex and cerebellum. The cerebral cortex and cerebellum is the area of the brain responsible for alertness and motor coordination, which can become impaired under the influence of marijuana and cannabis. So in terms of the mode of action, when cannabis is smoked, its effects are perceived within minutes. The effect can be felt between 30 minutes and 2 hours. And in the body, the cannabinoids can accumulate in fatty tissue, and it's slow to release, and it can take up to 30 days to release, which is why the use of marijuana can be problematic when you are subject to drug testing in the workplace. In terms of the elimination of cannabinoids, about 25% is excreted through urine and 65% is excreted into the GI tract, from which they are reabsorbed into the body. Side effects can include a difficulty to distinguish, and they can be isolated, or in frequent use can cause mild intoxication, drowsiness, and sedation, slower reaction time, and memory deficiency. Regular consumption can lead to social detachment and psychological dependence. Catalepsy, which is muscular rigidity and fixation of posture regardless of the external stimuli, as well as decreased sensitivity to pain. Analgesia, which is relief of pain. And antiemetic, which can be used to treat nausea and vomiting and motion sickness. Some adverse side effects are covered in our text, Drugs and Sport, and there's a you can take a look here and see that paranoia, dizziness, anxiety, tachycardia, these are not all side effects that will definitely occur. They just can occur with different people, and none of these may occur at all with some people, but these are potential adverse effects. Some symptoms of withdrawal can include cravings, anger and irritability, and an inability to concentrate. In terms of sport use, the International Olympic Committee first included cannabis on its list of prohibited substances in 1989 under the heading Classes of Prohibited Substances in Certain Circumstances. At that time, not all sports included cannabis on their prohibited list, which led to confusion. And again, in 2004, the World Anti-Doping Agency removed any doubt by placing it on the prohibited list for all athletes in all sports within competition. The recreational use of cannabis is common among even elite athletes. So here's a picture of Michael Phelps, who train at the most diligent and disciplined levels. The pressure to compete at this high level and the attention and admiration that it draws also puts athletes in very vulnerable situations. Are they performance enhancing? Recreational cannabis use can produce a feeling of euphoria and reduce anxiety, so it may be beneficial in alleviating the stress induced through competition and calm an athlete prior to competition. Smoking, however, though, can impair your cognition, psychomotor performance, and exercise performance. So it is inconclusive and can very much state that it's not a performance enhancer. So in terms of passive ingestion of cannabinoids, it can depend on factors such as the size of the room and the ventilation, the number of cigarettes being smoked, and the concentration of THC. So this is basically secondhand smoke for marijuana. And the conclusion is urinary levels exceeding 15 milligrams per milliliter occurred only after extremely severe cases of passive exposure to smoke. So it's also known as environmental or secondhand ingestion. This has been a common excuse by athletes who have tested positive for marijuana. They've often used the excuse that they were in a room where others were using the drug and took in secondhand smoke, which is why the World Anti-Doping Agency has had to come up with some thresholds to account for that. As in recent legalization of marijuana for adult cases in various states such as Colorado and Washington, the place of cannabinoids on the WADA list of banned substances is also hotly debated. Eventually, we will see sports starting to reflect society and culture more in terms of the legal use of it and not having it as a banned substance. Arguments for are that cannabinoids produce a wide variety of psychological and physical effects within the body and could have consequences for fellow competitors. Who wants to compete against somebody who is under the influence of a drug that may impair their judgment and could cause injury? And for instance, someone maybe who's on a bobsled driver going very fast down a chute and put his fellow athletes at risk. Against could be the fact that in most countries possession and consumption is illegal, and therefore the World Anti-Doping Agency doesn't need to impose further levels of legislation. Let's turn our attention to hallucinogens. Hallucinogens are drugs that produce what they call a psychedelic or all-arounder effect, ranging from a stimulant to a depressant, and can dangerously alter your level of consciousness. Synesthesia is a condition in which a stimulus evokes not only the sensation appropriate to it, but also another sensation of a different character, such as when a certain color evokes a certain specific smell. Flashbacks are a perceptual distortion or bizarre thought that recurs after the chemical effects of the drug have worn off. Inhalants, also on the dangerous level, that can slow down or deaden our responses and bodily functions. They can originate from volatile solvents, nitrates, anesthetics, and are also self-administered through means of sniffing, snorting, bagging, and huffing. So drinkers don't typically distinguish between a hangover and true withdrawal symptoms. To our great-great-grandparents, it all felt the same. In terms of alcohol consumption, alcohol is the #1 drug problem in the United States. It's considered a depressant to calm nerves and reduce anxiety and pain, and can produce self-confidence and affect sleep patterns and decrease sleep quality. Binge drinking, which is common in the university setting, is 5 or more drinks in one night. Think about a typical night. can affect your brain and body and activity for up to 3 days, and 2 consecutive nights can affect an athlete for up to 5 days. Being drunk Friday and Saturday can affect Thursday's performance, and it is banned by the IOC at certain levels. So sugar comes from fruit, berries, vegetables, or grains. Yeast feeds on the sugar and excretes alcohol and carbon dioxide. This is pretty much how alcohol is produced. Here we see some of the various alcohol content levels, which range from 4 to 6% for various beers, or 8 to 9% for malt liquors, to 6% in wine coolers and 12 to 14% in most wines, and up to 40 to 43% in hard liquor, including scotch, vodka, gin, and whiskey. Note, 100% alcohol equals 200 proof. Alcohol is a legal drug in most countries, and the preference for beer, wine, or distilled liquors depends upon the country's culture and on the availability of certain kinds of beverages and on the specific occasion. These soccer fans are consoling themselves after their team's defeat, and they would probably drink with the same intensity if their team had won. So the metabolism of alcohol occurs in several stages involving oxidation. First, the enzyme alcohol dehydrogenase is found in the stomach and liver and acts on ethyl alcohol to form acetaldehyde, which is a highly toxic substance. Acetaldehyde is then quickly altered by a second enzyme, acetaldehyde dehydrogenase, which then oxidizes it into acetic acid, and acetic acid is then further oxidized into carbon dioxide and water. As consumption increases, the amount of alcohol absorbed increases, and therefore its effects on the body increases. This happens at very different rates depending upon the physical and mental makeup of the drinker. It's not the same for all people. The effects of alcohol are directly related to the amount of consumed and the frequency of use, as well as the drinker's underlying personality and mental health. Many mental health effects are caused by alcohol's effect on our body, such as our neurotransmitters such as serotonin and GABA. Many of the physical effects are caused by direct toxic effects on the liver, heart, and other tissues, as well as the depressant's effect on the autonomic nervous system. In terms of our liver, when drinking, it can cause a fatty liver, or the organ that has difficulty functioning normally, so the drinker has problems digesting food. When the drinker stops, most of the fat disappears and the function returns to almost normal, unless cirrhosis, which is alcoholic hepatitis or hepatitis B or C, has taken hold. Malnutrition is a condition found in many chronic alcoholics. Here we see what they call a cirrhotic liver, from cirrhosis of the liver. It's usually brought about by excessive drinking and takes 10 or more years of steady drinking to develop. Alcohol can cause fatty deposits and scarring of the liver, and the damage cannot be repaired, and only abstinence halts its progression. Alcohol also kills nerve cells, kidney cells, brain cells, and other tissues. A heavy drinker can kill as many as 10 times the number of brain cells that normally die each day. Here we see a picture of, on the left is a normal heart with well-infused blood in its system, and on the right is what they call a fatty or enlarged heart of a heavy drinker. It is important to remember that although light to moderate drinking can be somewhat beneficial to cardiovascular health, past a certain point the damage outweighs the benefits. In addition to the direct toxic effects of alcohol on the liver and other bodily tissues, many deaths are caused by the loss of coordination, the lowering of inhibitions, respiratory depression, alcohol-induced depression and or anger, and the aggravation of mental conditions that can occur when under the influence of alcohol. This slide shows an imaging study of the brain where the red and pink areas in these scans show brain activity during a memory task. Brain activity in the heavy drinker is greatly suppressed, which could lead to problems later in life. According to one study, 47% of those who began drinking alcohol before the age of 14 will become alcohol dependent at some time in their lives, compared to 9% who wait until the age of 21. So the chemical makeup of alcohol, it is a depressant. It's made up of ethyl alcohol. A proof value, when you see that something is the proof value on the side of a label of hard liquor and alcohol, it's 2 times the percentage concentration. So 100% alcohol is 200 proof. Ingestion, 7 calories per gram. One drink could be 14 to 17 grams or 100 to 120 calories. Again, these are what they would call typically empty calories, not any true or real nutritional value ultimately. Absorption, 20% is absorbed from the stomach and 75% is absorbed in the small intestines most rapidly. Alcohol is transported throughout the body and via the bloodstream. It easily moves through the biological membranes, and the main area of absorption is the small intestine. The main site for metabolism is the liver. These are important factors for your tests. The main area of absorption is the small intestine, and the main site for metabolism is the liver. 2 to 20% of ingested alcohol is metabolized in the liver, which is why the liver works extra hard when you ingest alcohol. Again, in terms of the metabolism of alcohol, it can penetrate biological membranes and be absorbed unaltered from the stomach, but it also moves quickly from the small intestine. Again, from the GI tract, the alcohol is transported to the liver and the hepatic circulation, and 75% of alcohol taken up by the blood is released as acetate. Acetate is then oxidized into carbon dioxide and water within the Krebs cycle or the citric cycle, which is an energy cycle that our body uses to convert energy from foods. Alcohol is distributed throughout the body through the circulatory system, and distribution among the bodily fluids and tissues depends upon blood flow and the mass of tissue. Again, we could see more information here on the metabolism of alcohol and how it's excreted throughout our body through urine and sweat. Again, alcohol can penetrate the blood-brain barrier and stimulate the release of dopamine. It's regarded as a pleasure-related hormone, and dopamine is triggered in the limbic system. The stimulation of sweat glands occur and pain sensors are numbed, and later the cerebellum is affected, causing balance issues. This is basically the situation when somebody says they're buzzed. Their balance is impaired and their pain sensors are numbed, and they're feeling a lot of pleasure receptors, and their dopamine is being released in the body. Again, we see alcohol in the nervous system and the effects that it has. It can affect reaction time, hand-eye coordination, tracking ability, and the control of smooth and precise movement, which is why drinking and driving can be so dangerous. Alcohol and health. The effects of alcohol is typically viewed in terms of the chronic use of alcohol over time. Alcoholism is a disease and a behavioral disorder rather than a vice. And excessive drinking manifests itself in liver disease, increased risk of breast cancer in women, cancer in the bowels, pharynx, larynx, and esophagus, and of course enlarged heart, which is a condition called cardiomyopathy or cardiomegaly. Oddly enough, alcohol was formerly used as an anesthetic until it was realized it was too dangerous to supply in large quantities for that purpose. Alcohol may also impair absorption of minerals and vitamins, which is why many alcoholics are malnourished. Some of the immediate effects of alcohol on health: it depends on the person. There could be a hangover, there can be alcohol poisoning. Using alcohol with other drugs, which is multi-drug use, can be a problem because the liver doesn't know what to filter out. Alcohol-related injuries and violence, and of course alcohol and sexual decision making. can be a big problem. Drinking and driving. Here we see some statistics that we're more than well aware of the alcohol-related deaths on the road from drinking and driving. More statistics here in terms of the relative probability of an auto crash based on the number of drinks that you take. After a couple of drinks, you can see that how your blood alcohol concentration tends to go up rapidly, and the risk of being in an automobile accident after a couple of drinks also goes up rapidly. Blood alcohol concentration is the amount of alcohol in the blood in terms of weight per unit volume and is used as a measure of intoxication. The graph shown shows the approximate blood alcohol concentration and body weight, and it's called the BAC of an average person, and it's a given weight after drinking the specific number of drinks in the time shown. A level of impairment is associated with blood alcohol content. So again, some of the common effects of chronic alcohol use to our digestive system, our liver function, our cardiovascular system, can also lead to cancer, brain damage, and an earlier death with less quality of life leading up to that death. Here we see a diagram of the effects of alcohol on various senses and organs within our body. Pregnancy and alcohol use. The consequences of drinking during pregnancy are life-altering. The earlier in the pregnancy that someone is drinking, the worse the consequences can be on the unborn fetus. Fetal alcohol syndrome occurs in 1 or 2 out of every 1,000 live births, tend to be underweight, and have various physical characteristics such as a flat nasal bridge or long upper lip, may have heart defects, and as they do grow older, their mental and physical growth can be diminished and slower. Alcohol-related neurodevelopmental disorders also occur. So again, alcohol abuse and dependence. Abuse is the recurrent use that has negative consequences, and dependence or alcoholism has more extensive problems, tolerance, and withdrawal. Some warning signs of alcohol abuse include drinking alone, which is not social drinking, using deliberately and repeatedly, feeling uncomfortable on certain occasions if you don't have alcohol, escalating your consumption of alcohol, getting drunk regularly, and drinking in the morning or unusual times. So here we see some more information on alcohol abuse. Binge drinking, which is having 5 drinks in a row for a man or 4 in a row for a woman. Frequent binge drinking in college, where 3 to 7 times more likely than non-binge drinkers to engage in unplanned or unprotected sex. So again, it impairs your judgment in relationships as well. There are some gender and ethnic differences statistically. Men tend to start at a younger age as a certain rite of passage into manhood, and women tend to start at an older age, which can progress into alcoholism later in life after years of controlled drinking. Sadly, African Americans face a disproportionately high rate of alcohol-related diseases and birth defects and cancer, cirrhosis, and heart disease associated with long-term use of alcohol. African American women are more likely to abstain from alcohol than Caucasian women, and AA groups tend to have greater success in the African American community. Latinos, drunk driving and cirrhosis are among the highest rates of death in Latino men. Treatment involving the entire family is important because of the emphasis on family pride and the importance of family gatherings where alcohol can be a central part of the family gathering. Asian Americans tend to have less than average rates of alcohol-related deaths, but can be, again, also affected. It doesn't discriminate any group. American Indians and Alaska Natives, alcohol abuse is among the most severe in the country, particularly among adolescents and young adults. Alcoholism is twice that of the general population among Native Americans, and treatment does need to be more effective if they're going to, and if they reflect each tribe's values. So yes, we do have a long way to go in terms of treatment and making sure that each demographic group has access to good quality care and treatment. In terms of promoting responsible drinking, you want to encourage responsible attitudes, be a responsible host, hold the drinkers responsible for what they've ingested and cut them off if need be, learn about prevention programs, and take community action. Alcohol in sports, a certain amount of pre-competition anxiety is inevitable, and anxiety responses vary enormously between individuals, and sports has not been eliminated from alcohol use, and in fact many athletes have used alcohol to calm their nerves prior to competition, thinking that would be a remedy to help ease their anxiety. Alcohol in athletics is often a bonding among players socially after games, and it's more prevalent among athletes than among non-athletes, oddly enough. Drinking is done both during the celebration of victories and defeats, and you can't go to a sporting event without seeing alcohol-related sponsorships all over the arenas, and a big part of the sponsorship of the major sports teams. So alcohol in sport, occasional moderate drinking will have little adverse effect. Alcohol does not seem to have adverse effects on maximum oxygen consumption, metabolic responses to exercise or disease, or high intensity exercise, that alcohol does not have an effect on. There is a link between anxiety and performance. Moderate amounts of anxiety can be desirable to induce the right level of harnessed motivation for action, which is why you don't want to reduce that anxiety level by drinking. Again, sometimes the more nervous you are, perhaps to a point you can become more alert, oriented, and ready for competition, that you don't want to numb that with alcohol use. Again, there are anxiety reducing strategies that need to be done by athletes, such as mental relaxation techniques, legitimate drugs that a physician may be able to prescribe you with a therapeutic use exemption, and the anxiety level can depend upon the sport as well as the individual. Anxiety in performance can lead to an aggressive attitude, such as hyper-aggressive tackling in athletics, or being overly physical and perhaps fouling out in basketball. Drinking the night before a competition can have adverse consequences on performance due to a hangover effect. Oftentimes you'll hear about an athlete who missed the game due to quote-unquote flu-like symptoms when perhaps they were out partying the night before. Impairment depends upon the concentration of the drink, the timing of the ingestion, and the individual's susceptibility. So in terms of alcohol and aiming sports, such as archery and shooting events, muscle strength is needed to draw the bow in archery, and muscle endurance is required to hold the bow steady, and deflection of the arrow tip by 0.02 millimeters at from a 90-minute target will result in missing the target. So you do need to have a steady hand. So let's take a break from alcohol and talk a little bit about tobacco. So why do people use tobacco? Why do athletes use tobacco? Well, it is prevalent throughout our culture and society, so why not in sports as well? It's a powerful psychoactive drug. It can reach the brain via the bloodstream in seconds, and it is very addictive, and it can be a psychoactive drug. And the tolerance and withdrawal can be difficult for athletes as well, who have become accustomed to using it. Despite strong anti-tobacco campaigns, and with dramatic stories of mouth cancer, and chewing and dipping tobacco may not be as prevalent as it was in the past, but it is still used and visible by very prominent players and coaches. It seems unbelievable, but at one time athletes and even medical professionals not only smoked, but they endorsed tobacco products. In some cases, the stimulating effect of tobacco were advertised to help their performance. The advertisement in the middle is an ad for the old New York Giants baseball team. that said that 21 out of 23 Giants world champions smoked Camels. So hey, why not me? So why start in the first place? Children and teenagers make up 90% of all new smokers in the country, and the average age is 13 for smoking and even 10 for spit or chewing tobacco. Advertising plays a big factor in tobacco use. Some of the highest advertised brands include Marlboro, Camel, and Newport, and 90% of teens prefer the top 3 most advertised brands. Even the advertising campaigns like Joe Camel became a more familiar figure or caricature among youth than even Mickey Mouse. So some of the characteristics or traits that could increase the potential use of tobacco would be a parent or sibling of a child that uses tobacco, peers who use tobacco. The child comes from perhaps a blue-collar family that may not be highly educated, or it comes from a low-income home, single parent, performs poorly in school, or maybe has dropped out or has positive attitudes towards tobacco. The health hazards of tobacco are pretty well known in terms of the pollutants and the potential for cancer that it can cause, as well as just various pulmonary and respiratory diseases. Again, we can see that it's highly carcinogenic. Large amounts of carbon monoxide come through it, and as well as the nearly 600 chemical additives that are in tobacco that our body may respond poorly to. In terms of our health hazards, we can see coronary heart disease, among one of them, atherosclerosis, angina pectoris, myocardial infarction, stroke, aortic aneurysms, emphysema, chronic bronchitis. There's a good reason why your insurance companies do not want you using smoking cigarettes or other tobacco products, as it will make you a higher risk for injury and illness, and could be cause for higher health bills later that they don't want to have to pay for. So here we see a slide that shows how nicotine affects the body and the nervous system. And we also see here the effects that it has on our respiratory passages in this slide. It does affect the ciliated or the hair-like cells in the respiratory passages, so the mucus can't be cleared out of your lungs as easily, and can cause for a buildup of fluid in our lungs. Some of the additional health, cosmetic, and economic concerns related to tobacco can include ulcers, impotence, reproductive health problems, dental disease, diminished physical senses, injuries, cosmetic concerns, and economic costs on the whole. So some of the cumulative effects of smoking: males who smoke before they're 15 years old are half as likely to live to 75 versus those who did not smoke at all. Females with similar health habits reduce their life expectancy by more than 10 years, and female smokers spend 17% more sick days in bed than non-smokers, and both men and women show a greater rate of acute and chronic diseases from using tobacco. There are various other forms of tobacco, such as spit or smokeless tobacco, more than 6.5 million adults, cigars and pipes, and of course clove cigarettes and bidis, which is twice the tar, nicotine, and carbon monoxide. These are cigarettes that don't have filters on them and are very high in their toxic harm and tar content. Some of the ads for tobacco use have included people that have lost important breathing organs and have had to use speaking devices to be able to communicate, and using it as a deterrent for smoking. And this is what they call a not just a harm reduction technique, but an abstinence technique. Don't get started at all with smoking because it's difficult to stop. People try to stop, they try to quit, and it's so highly addictive they say don't even start in the first place. Again, environmental tobacco smoke, also known as secondhand smoke, can also be a carcinogenic means of getting cancer. Environmental tobacco smoke is a human carcinogen designated by the Department of Health and Human Services, and side stream smoke is that which enters the atmosphere from the burning end of a cigarette, cigar, or pipe, as well as smoke that is exhaled by the smoker. Since it is inhaled without a filter, it has twice as much tar and nicotine and 3 times as much carbon dioxide. That's why, because you're not using a filter when you're smoking secondhand smoke or side stream smoke. You're taking that in. Mainstream smoke is that smoke which is inhaled again by the smoker and then exhaled into the atmosphere. And the side stream smoke is that smoke that comes from the burning pipe, cigarette, or cigar. Again, some of the effects include coughs, allergies, lung cancer risks, and of course, death rates increase exponentially and can contribute to increased asthma attacks. With children, environmental tobacco smoke can cause sudden infant death syndrome, asthma, respiratory infections. It can show up in their breast milk. And children can inhale 3 times more pollutants per unit weight than adults. So it's very damaging to young children. So in terms of avoiding environmental tobacco smoke, go ahead. It's important to speak up tactfully, display reminders, don't allow smoking in your house or your home or any rooms, open a window if somebody's smoking, provide better ventilation, sit in the non-smoking section, fight for a smoke-free environment, and discuss quitting strategies. Here in California, you don't tend to have a big problem with this, but other parts of the country, and if you travel abroad, smoking is a lot more prevalent and allowed in public places. As we know, the cost of tobacco use to society and healthcare is enormous, and the amount of death and illness and days lost in work every year related to tobacco use has shown it to be a very costly and destructive physically drug and chemical. In terms of quitting, the benefits of quitting are that our bodies can often recover from quitting smoking, and we can regain a lot of our physiological function after quitting. There are smoking cessation programs such as Chantix and Zyban, and nicotine replacement products such as patches, gums, lozenges, nasal sprays, and inhalers. And if you are working, once you start working, it is good to go to your human resource department and find out if there are smoking cessation programs that most employers will participate in. So in terms of treatment programs, not every program works for every person. Alcoholics Anonymous or 12-step programs, Al-Anon employee assistance programs through your employer, inpatient hospital rehabilitation, and of course there are pharmacological treatments to help people detox and get off the use of the illicit drugs that they're using. So the treatment for drug dependence is the topic, is a topic that gets brought up, and there are various strategies that are used for drug dependence. Harm reduction strategies such as needle and syringe exchange programs for intravenous drug users, abusers, and designated drivers for those who are intoxicated has been suggested by experts in the field to provide free testing for street drugs in purity and potency to help users avoid unintentional toxicity or overdose. So these are harm reduction strategies such as needle exchange programs or drink responsibly, which is Budweiser's approach. There's also the abstinence model, which is what Alcoholics Anonymous uses, is to stop using alcohol altogether or narcotics altogether. And again, codependency is a relationship in which a non-substance abusing partner or family member is controlled by the abuser's behavior, and the codependent people in the family frequently engage in enabling behaviors for the user. This can be in the form of making excuses, giving multiple chances, loaning them possessions or money that allows them to continue using the drugs, or even ignoring the problem because you dread the reaction from the abuser. So this is a big problem. Sometimes we're not helping or loving the person that we're caring for by becoming codependent in their problem. Here we see some common treatment strategies. These are two basic approaches that are used. The harm reduction approach, which is moderated and controlled use of the drug, such as needle exchange programs and drink responsibly. It considers abstinence or cutting yourself off from the drug use as unrealistic for an addict, but it understands the futility of a prohibitive stance on drug and alcohol use. On abstinence, the use of the drug that you are trying to get off of addiction is prohibited. It's basically called a cold turkey approach. Examples are the Just Say No campaign championed by First Lady Nancy Reagan in the 1980s. And Alcoholics Anonymous and Narcotics Anonymous tend to use this non-negotiable approach, with the idea that you can never really recover from an addiction if you continue to revisit it and continue to use and abuse those drugs. Again, we've talked about codependency. It's a relationship in which a non-substance abusing partner or family member is controlled by the abuser's behavior, and they enable the user and abuser to continue their behavior and make excuses for them. And here we see a little bit of a model of codependency and what it can lead to, the circle of codependency. So government attempts at drug abuse prevention tend to focus on stopping the production, importing, and distribution of illegal drugs through organizations like the Drug Enforcement Agency, and efforts need to be created and developed that help decrease the demand for drugs. The indirect approach includes helping to educate and motivate your children by building their self-esteem, improving study habits and academic skills, and increasing recreational opportunities. Direct approaches like the Just Say No campaign of the 1980s again focused on peer pressure resistance and the facts of the adverse effects of the drug abuse. You remember seeing the old advertisement where they showed a frying pan and you cracked an egg into the frying pan and it said, "This is your brain on drugs," and it showed the egg frying like your brain would be frying, and it said, "Any questions?" That was the approach of showing a rather dramatic look at something frying, and that would be your brain on drugs. So let's look ahead. In the decades ahead, research needs to continue because the cost of drug use on societies and the toll that it takes on them financially, emotionally, and physically is too great. Legalization may be able to regulate the quality of the drug products that are being produced and end up on the street, and will purportedly eliminate a large part of the criminal element involved. Cost-effective, less invasive, and accurate, reliable forms of drug testing also need to be researched and developed, especially in drugs being used in sports and athletics. Better testing for urinalysis and determining if banned substances have been used by athletes. The technology needs to catch up and be more readily available with quicker results and more accurate results. So we'll take a review here at some of the questions. So alcohol is absorbed most rapidly in the small intestine, descending colon, stomach, or liver. The answer is it's absorbed most rapidly in the small intestine. Blank is a relationship in which a non-substance abusing partner or family member is controlled by the abuser's behavior, which is enabled, enmeshed, codependency, or platonic. And the answer is codependency. The following are true about environmental tobacco smoke, except it's only harmful to children. It can lead to increased asthmatic attacks. It's also known as secondhand smoke. It's a Class A carcinogen. The except would be that it's only harmful to children. It's harmful to everybody. The main site of alcohol metabolism is the gallbladder, kidney, liver, or stomach. The answer would be the liver. Blank is the habitual use of a drug produced by chemical changes in the user's body and the inability to stop a behavior despite its negative consequence. And the answer is addiction. That's the definition of addiction. The Just Say No drugs campaign of the 1980s is an example of the abstinence model.